good afternoon, good evening to all our viewers from across the world. At the outset, wishing everyone a very happy International Women's Day, and for our audience from India, a very happy Holi. I'm Kashish Shaneja from the O'Neill Institute for National and Global Health Law, where I lead our work in Asia at the Center for Transformational Health Law. At the center, our work focuses on reimagining national and global health law systems in light of lessons learned during the COVID-19 pandemic. Today, we have the privilege of hosting the launch of two very unique WHO policy briefs developed by the Department of Health Promotion of the WHO and the O'Neill Institute. These two policy briefs sit at the intersection of NCD's risk factor regulation and the COVID-19 pandemic response. While the first policy brief focuses on policy response to alcohol consumption and tobacco use during the COVID-19 pandemic in the WHO Southeast Asia region, the second brief focuses on the policy response to alcohol consumption during the pandemic in 7 countries of the WHO African region. Both policy briefs were published last year. Links to both briefs are shared in the Zoom Q&A box, and you can also find them on WHO and O'Neill Institute's website. Before we dive into our discussion, a few housekeeping announcements. The session is being recorded. The audience can use the Q&A box to ask questions to the speakers. I'll take up the questions at the end once all speakers have given their presentations. Today, we have an amazing set of speakers who will discuss about alcohol and tobacco regulatory changes during the COVID-19 pandemic in the 2 regions. The speakers will explore the lessons learned from the COVID-19 pandemic for tobacco and alcohol control and discuss guidance for future pandemic events, bringing together findings from the 2 policy briefs. Our first speaker for the day is Dr. Rüdiger Kritsch. Dr. Rüdiger is a director of the Department of Health Promotion at the WHO in Geneva since September 2019. He heads WHO's work on risk factors such as tobacco consumption and harmful use of alcohol. He is responsible for work on health promoting settings and programs for more physical activity. In addition to the normative work, his team supports member states with appropriate health promotion instruments such as health literacy, empowerment, and community engagement, public health legislation, and fiscal measures to design well-being societies. Rüdiger, over to you.
Thank you very much, Kashish, and a very good morning, good afternoon to all of you. And I'm really delighted we can have this discussion today on looking at the alcohol consumption during COVID. Let me share a couple of insights that we got from reviewing the evidence so far. So first of all, this pandemic caught us in the alcohol control world unprepared. So on 11th March of 2020, the WHO declared COVID-19 a public health emergency of international concern, and the effects of COVID-19 have been both direct in terms of morbidity and mortality from the virus, and indirect through strained health and social systems and the depression of global economies. Second, the isolation exacerbated the depression and addictive behaviors. As a consequence, people consumed more alcohol and used more tobacco. The adoption of public health measures such as travel restrictions, physical distancing, and stay-at-home directives has significantly changed how goods were produced and are purchased and consumed, including unhealthy commodities such as alcohol and tobacco. Although necessary to reduce infections, these measures may have also increased the risk associated with the consumption of these and other products. So we need to learn from experience. We documented, analyzed, and synthesized the policy measures put in place by 18 countries, and out of these 18 countries, 11 in the Southeast Asia and 7 in Southern Africa. So the study period was from 1st of January 2020 to the 30th of July in 2022. The measures countries applied during the pandemic. So raised awareness is the first one. The policy measures implemented to restrict alcohol consumption included raising awareness about the harmful effects of alcohol consumption and restricting advertising. There were increased services. Some countries strengthened support to those who consume alcohol by increasing telephone and virtual mental health supports. They also restricted availability. So most governments enacted public health restrictions, including closing bars and restaurants and issuing stay-at-home orders. In addition, many governments restricted the availability of alcohol beverages by regulating social gatherings due to the increased risks related to COVID-19. Most common measures included restricting on and off-premises sales and limiting sales hours. Regarding affordability, so very few countries implemented measures to reduce the affordability of alcohol. Most countries that had policy restrictions on the sale of alcohol did not have clear measures on alcohol taxations. So again, some lessons learned. Only few efforts to curb the consumption of alcohol have been extended beyond the initial waves of the pandemic. So at the start, there was a strong regulation to curb alcohol consumption, and that was seen in basically all countries. Evaluations found that, however, alcohol availability restrictions led to positive results, including a significant reduction in the burden on the health systems and reduced harm caused by alcohol consumption, and a reduction in unnatural deaths. However, as I said, in almost all countries, those restrictions could have been maintained beyond the first wave of the COVID-19 pandemic, but were not. Second, different regulatory approaches may be needed to target diverse populations. Public health law can play a critical role in consolidating the measures for regulating alcohol consumption at the national and subnational levels. The Lancet Commission on Lessons for the Future from the COVID-19 pandemic reiterated that public policy failed to adequately address the profoundly unequal effects of the pandemic on different groups. Thirdly, regulations to address the availability of alcohol are intertwined with public health measures. The lockdown measures showed positive effects on curbing alcohol consumption and associated risks in the relatively short period regulations were in place. For example, restrictions on weddings and family gatherings were critical in reducing not only the spread of COVID-19, but also on alcohol consumption. However, regulations on alcohol control reverted to their pre-pandemic status when restrictions on gatherings and physical distancing were removed. The one exception was the sale hours of off-premises retailers, for which some governments took a phased approach. Fourth, relatively loose restrictions resulted in an expansion of online and home delivery. One of the most concerning trends during the pandemic is the significant expansion of online sales and home delivery of alcohol across all countries. In most of the studied countries, no specific measures were taken for online sales of alcohol or home delivery during the pandemic, and restrictions for on-premises sales of alcohol did not apply to online ordering and home delivery. This led to an unprecedented increase in alcohol consumption at home. Online ordering and home delivery increase access to and consumption of alcohol by younger people. This is associated with an increased risk of harm and probability of developing an alcohol use disorder in adulthood. Fifth, many countries in Africa and some in Southeast Asia experience an increase in the illicit trade of alcohol beverages. Many countries experienced an increase in illicit alcohol trade during the pandemic. In the face of widespread restrictions in many countries, alcohol was made available by unregistered vendors or the continued illegal sales from outlets in small quantities. The smuggling of alcohol between borders into certain countries with more restrictions was of particular concern. Illicitly produced and procured alcohol poses additional risks to consumers' health, as there is no quality control over how these products are made, and they can contain ingredients that increase the risk of poisoning. Sixth, civil society organizations stepped up to support alcohol control. Though many of the measures fell short of reducing alcohol consumption over the long term, civil society organizations and community-led efforts were decisive in creating momentum and accelerating grassroots action to raise public demand for change. Their activities included lobbying, advocacy, pursuing legal actions, and demanding the development of awareness campaigns. Seventh, national authorities may be effective partners in curbing alcohol consumption and tobacco use. The 11 countries studied showed that subnational authorities were effective partners in altering the availability of alcohol and tobacco during the pandemic. This trend was observed in India, in Myanmar, in Nepal, and Thailand, where restrictions on availability differed by state or region. Eighth, industry interference. Their governments may feel indebted to the industry after the COVID-19 pandemic. Most countries reported increased corporate social responsibility activities by the alcohol industry, such as donations of sanitizer and personal protective equipment, or monetary donations to the government. The alcohol industry also lobbied against government restrictions, conducted misinformation campaigns targeted at undermining evidence of the health risks associated with alcohol consumption, and litigation against government decisions. This interference may leave governments feeling indebted to the alcohol industry. Further, countries will need to address the perception that the alcohol industry is a critical and legitimate stakeholder in developing public health policies. So these, colleagues, were some of the lessons learned from this review of studies and evidence that can perhaps lead our discussions a bit further. And with this, back to you, Chair. Thank you very much.
Thank you so much, Rudiger. That was really insightful and helpful in putting into context the importance of the two policy briefs. Our next speaker for the day is Jagdish Kaur. Jagdish is presently the Regional Advisor Tobacco-Free Initiative at WHO's Regional Office for Southeast Asia. She's a medical doctor and public health expert trained in global tobacco control from Johns Hopkins. She has long-standing experience in tobacco and NCD surveillance at the national regional level. Dr. Kaur was awarded WHO Director General's Award for Excellence in December 2022 for leading the development of WHO's first ever app on quitting tobacco use. Over to you, Jagdish.
Thank you so much, Kashish. Good morning, good afternoon, and good evening, colleagues. So as mentioned by Rudiger, the tobacco control world was also caught unprepared by the pandemic. And then we have also many learnings from this experience. During the pandemic, the governments in the member states of Southeast Asia region, they took steps to change the acceptability, affordability, and availability of tobacco products. And this region, it's one of the highest tobacco consuming region in the world, and we constitute 1/4 of the global population. So we really matter in the world of tobacco control. So governments took various measures during the pandemic period, and they ranged from raising awareness. There were media campaigns to tell people about the risk of severe COVID-19 outcomes for the tobacco users. And then there were advertisement restrictions by countries, and specifically India, and restricting the manufacturing of tobacco. Focusing on tobacco manufacturing was also India. They stopped manufacturing of tobacco. There was complete shutdown. Then there was restrictions on tobacco sales. So both, online and offline sales, they were affected, and this was reported by Maldives, Nepal, Sri Lanka, Thailand, and India. there was increase in tobacco taxes, but that was not directly because of the pandemic effect. This was, kind of it's one of the best buys, and countries did raise tobacco taxes, as part of their routine raise in taxes, and that continued. But that is significant, because that was not stopped. And besides that, there was industry participation, we call it industry interference, and 6 countries reported it, but it must have been in others also because, it occurs directly and indirectly. And that was basically in 2 forms. One is corporate social responsibility, where industry came forward to support the governments, both in cash and kind. So huge amounts of cash were paid at national and subnational level, and in kind, they supplied the PPE kits, ventilators, sanitizers, masks, and other things, logistics. And they said that, they are helping the governments. And at that time, because the priority for the government was dealing with the pandemic, so this support was taken. Otherwise, as per Framework Convention on Tobacco Control, Article 5.3, governments cannot associate it with tobacco industry anyway. But this, like, everybody was caught unaware, and so much was happening. So governments did take help of the industry. And then there was direct interference. There were incidences. The glaring one, I can say from Bangladesh, where the multinational countries, they tried to undermine the tobacco control law, and they cited one very old law, and they pressurized the government to allow them to manufacture and sell tobacco products. So this was an example from Bangladesh, where there was an interference example. Then one important thing which I would like to mention, there were 2 important rollbacks on the policies. The important one from Bhutan, because Bhutan is the only country in the world which had ban on right from manufacturing, production, sale, dissemination, and restrictions on processing tobacco products for personal use. So they rolled back this ban, and they amended the tobacco control law in 2021. That was a big setback, and everybody was caught by surprise because they are very strict in tobacco control. So they said that because of this cross-border, migration, and then COVID is spreading and all those things, and they started supplying tobacco products through retail outlets, custom designated shops, and people started getting it, which they needed to buy otherwise, for their personal things and in a restrictive manner. So, but now it was available. So that was a big thing. And for Indonesia, there was, they granted a deferral of excise tax payment to manufacturers, and those included tobacco manufacturers. So this was, in fact, a little, away from the usual practice. And if we look at, and if we talk about, what worked, what helped, so 10 out of 11 countries in the region, they are parties to the WHO FCTC Framework Convention on Tobacco Control, and they were already implementing the treaty. And all the countries have laws, tobacco control laws. So we had certain things in place, which were taking care of tobacco control at the ground level. And countries also used related laws and government directives, like India came out with a ban on spitting, and then there was a ban on manufacturing. So this was used by the countries. And then there were partnerships, and like Rudiger also mentioned, for alcohol, at the subnational level, at the grassroots level, especially CSOs, they came forward, for supporting various areas of tobacco control. And one challenge of tackling the misinformation, giving the right information, the correct information, that was important, because industry was out to spread misinformation. And Thailand, they dismissed unreliable and biased research, which was suggesting, smoking as a preventive measure for COVID-19. So we needed to tell people, this is not correct. So this was also happening during, because industry was making full use of the pandemic, and then, coming out, having all their tactics in open. And this, association, or kind of, we can say, the help which governments took from the industry, it becomes a risk which needs to be followed, and in future, because this cannot be continued. Like I already said, that Article 5.3 of WHO FCTC prohibits this, and that needs to be reminded, that needs to be told that, whatever happened has happened, but now, we need to find the ways that how we can do without their support. And some of the main lessons learned, if I say, we have to strengthen the WHO FCTC implementation at the country level. We have to strengthen our tobacco control laws. We have to see, what loopholes were used by the industry, how they came in with their CSR and direct interference, and how we can plug those loopholes in the meantime. And we have to, of course, strengthen the health system and mainstream tobacco control, integrate tobacco control, into the health systems. And we saw, how health systems in the vulnerable countries, they collapsed during the, even in the developed world, what happened. So we need to now do that. We have to be strengthened, we have to be resilient. And third was building capacity for tobacco cessation, because nicotine is one of the most addictive substance, and people tried hard to get, tobacco products from anywhere. So India, as an example, the quit line was bombarded with calls, and they could not handle the calls. And M cessation, because this was not much advertised. So now, as a lesson learned, government is trying to integrate quit line and M cessation, so that the calls which are not being responded on the quit line, they can fall on the M cessation, and at least some information goes, to help with the quitting. So this is, we need to build, because some of the countries, they have very kind of rudimentary facilities for cessation, and we are trying to build upon cessation, because that help needs to be done. And this app also, which we came up, it's in the midst of the pandemic, we work for it so that everybody can make use of it, and, just download it and use it for help in quitting. And when the lockdown was, lifted, and in India, the pictures of the tobacco shops, they were to be seen. People just thronging the shops, and tobacco products going off shelf within minutes. So they're just trying to grab, maybe there is another lockdown announced, and before that they wanted to have their stock. So this kind of things, were witnessed, and we really need to help people there, in quitting. And then the good communication plans, we need to have to give correct information, like I said, and to counter the misinformation which industry tried to, spread at that time. So we need to have good communication plans that will be helpful. So the pandemic made us, wiser. We are kind of now, we know what happened. We had our experiences, we had our learnings, but we need to look into these experiences more deeply. We need more research, different aspects, and we need to see, like I said, what worked and what not, and what are the lessons learned. So how, we can use, and how we can become, more prepared with anything like this if it happens in future. So I think this is in briefly concerning the tobacco control from my side. Thank you so much. Thanks.
Thank you so much, Jagdish. Thank you for sharing the experience from the Southeast Asian region. I think it was particularly interesting learning the extreme regulatory changes that happened in Bhutan. Thank you. Our next speaker for the day is Safura Abdul Karim. Safura is a public health lawyer whose research focuses on using law to improve health outcomes. Currently an advocate at the Bridge Group of Advocates and a researcher at the School of Public Health, University of Western Cape, Safura recently completed her PhD in the development of a constitutional rights-based approach to NCD prevention. Safura will share South Africa's experience in regulating alcohol during the COVID-19 pandemic. Over to you, Safura.
Thank you, and thank you for the opportunity to speak today. Just to set the context, despite South Africa having a very, very small population of people who actually consume alcohol, alcohol is a significant risk factor for disease and contributes significantly to the burden of disease, primarily through injury resulting from motor vehicle collisions and gender-based violence. Despite this, for years and years, efforts to reform alcohol control in South Africa have basically languished in Parliament. That was until March of 2020, when overnight South Africa introduced an outright ban on not just the sale of alcohol, but shut down the entire operation and supply chain related to alcohol. While one might think that there was significant pushback initially, it was well understood among the public that this ban served a number of different purposes. At the forefront was a desire to curb the spread of COVID-19 and, most importantly, to free up the already limited resources that were available in critical care to those who would need it for COVID-19 infections. What we've seen is that over time, however, the pushback and public opinion of this alcohol ban changed quite drastically. Initially, there were some light-hearted articles about how one might brew pineapple beer in one's bathtub, but these quickly shifted into articles that were driven by industry narratives around the harm to the economy. And in one instance, I saw a very peculiar article about how the COVID-19 alcohol ban had resulted in a lack of organs to donate. Now, one might think that's brilliant, right? Fewer people are dying prematurely. But this article framed the shortage of organ donation, or organs that were available for transplant, as a problem that resulted from the alcohol ban, ignoring the benefits that were coming and the deaths that were prevented. Now, I'll talk just very briefly about the scheme of South Africa's alcohol ban. It came from the state of disaster declaration, and the overarching legislation was the Disaster Management Act. This act has a peculiar feature in that it enables the minister who's in charge of administering the disaster to introduce an outright ban on alcohol sales in the disaster area, which for South Africa was the entire country. Beyond that, the way in which the ban operated was in fact not specific to alcohol. Rather, the regulations specified which industries could operate. Initially, it was essential services, and then gradually it expanded to include others. And throughout this, the underlying rationale behind banning the alcohol industry from operating was that it wasn't an essential service. Of course, later on, when the infections had dropped, when the curve had been flattened, and when industry pushback was at a high, South Africa introduced more of a phased approach, which I think the other two speakers have discussed a little bit. And that was where really the alcohol ban stopped being effective, because a majority of alcohol consumption in South Africa happens in informal outlets, something that Dr. Kretsch had alluded to. And so this idea of using licenses, for example, to regulate the sale of alcohol actually wasn't feasible. And I think the last thing I'll add about that is, because the sales were happening primarily through these illicit, unregulated outlets, what we also saw is that the rest of the COVID-19 measures that were supposed to act in concert with the alcohol ban were also not being observed. So, for example, there was no social distancing. People were not obeying curfews in these establishments. When one looks at the results of South Africa's COVID-19 ban, it's very clear that there was a reduction in cases of and admissions to trauma units. And there's been differing accounts of whether or not it resulted in the reduction of alcohol sales. But I think the one thing that emerges from this, for South Africa at least, is that political will is key. We've seen that for years and years, there was no real effort or attempt to regulate alcohol. And then all of a sudden, there was a very comprehensive effort. Now, I think there were a lot of problems which are discussed in quite some detail in the report, so I'll leave that to you to read. But overall, I think it's a lesson to be learned that South Africa can, in fact, regulate alcohol very strongly and ultimately improve public health. Thank you.
Thank you so much, Safura. That was really insightful, and it was and the last point you mentioned about political will, I think it's a great example coming from South Africa. Thank you so much for sharing that. Our next speaker for the day is Nina Samidi. Nina currently serves as a program manager at the National Committee on Tobacco Control in Indonesia, where she's working on tobacco control policies based on WHO Empower principles. For more than a decade, she has been advocating for tobacco control, focusing on denormalizing tobacco use in Indonesia. Her work involves effectively communicating research settings, data and facts to create a compelling campaign narrative. Additionally, she's played a role in devising digital campaign strategies that encourage a shift in public opinion in Indonesia. Nina will share Indonesia's experience in regulating tobacco during the COVID-19 pandemic and what lessons can be drawn from Indonesia's experience. Over to you, Nina.
Thank you, Kasih. Hello, everyone. Good evening from Indonesia. I'm Nina Samidi from the National Committee on Tobacco Control Indonesia. According to my background, I will convey information specifically related to tobacco. So, in response to COVID-19, the Indonesian government declared a public health emergency and non-natural disaster based on the health quarantine law and implemented large-scale social restriction. We call it PSBB, including restriction on social and religious activities, restriction on movement, and closing down public spaces and work from home arrangement for school and offices. Indonesia didn't impose a nationwide lockdown and instead left it to local government with approval from the Ministry of Health to determine appropriate large-scale restriction for their jurisdiction. But there are three main points that I would like to make regarding tobacco consumption during the COVID-19 pandemic in Indonesia. First, how the tobacco industry takes advantage of the pandemic to carry out CSR washing to gain sympathy from the public and especially from the government. Second, how CSO try to make the government and society aware of the danger of smoking that increases the risk of COVID-19 and the connection of tobacco consumption to the economic problems faced by society during the pandemic. And third, how the government responds to the urge with the tobacco excise policy that determined based on arguments about the risk of tobacco to COVID-19. In April 2022, the Ministry of Finance granted a deferment of payment of excise tax for factory entrepreneurs or importers of accessible goods, including tobacco products, from the original 60 days to 90 days. The purpose of granting this relaxation was to help entrepreneurs strengthen cash flow during the coronavirus pandemic that had affected economic stability and industrial productivity. This was actually unnecessary because the tobacco industry experienced an increase in sales, as happened with Gudang Garam and Sampurna, which sales revenue rose significantly in 2021. According to our survey in 2020, across 25 provinces in Indonesia, the pandemic didn't lead to a reduction in cigarette consumption among smokers. In fact, it remained stable or even increased. The relaxation of tax payment suspension for the tobacco industry provided by the Ministry of Finance could be a result of tobacco companies' COVID-19 relief efforts to assist the government. For instance, in April 2022, PT Jarum and other Indonesian companies donated 100 units of ventilators, masks, protective goggles, and 75,000 personal protective equipment to the Indonesian Ministry of Health and the Indonesian Coronavirus Task Force. MOH and the National Disaster Mitigation Agency accepted the donation and expressed their gratitude towards the company, even in media. PT Gudang Garam, a clove cigarette manufacturing company, also donated an ambulance to support the operation of the Indonesian Red Cross in Kediri in addressing emergency needs during the pandemic. More recently, Sampurna partnered with Indonesian Chamber of Commerce and Industry to provide infrastructure and supporting facilities for a COVID vaccination center. Meanwhile, we along with the Tobacco Control Network are pushing the government to respond to the COVID-19 situation by incorporating tobacco control measures into COVID-19 handling policies. We have presented various arguments from health to economic through various webinars and talk shows involving government officials, submitting policy brief as follow-ups to the survey and a series of campaigns through mainstream and social media. It is challenging to include tobacco consumption control interventions in Indonesia's COVID-19 policy strategy because the need for medical equipment and direct handling of COVID-19 patients is considered more urgent, while the tobacco industry can provide it directly. However, the Ministry of Finance has set a 12.5% excise tax increase for 2021 and a 12% increase for 2022. In announcing this, Finance Ministry Sri Mulyani conveyed the excise tax increase by using arguments and research results by our arguments, civil society organization, focusing on the impact of consumption. Well, we understand that the government needs significant revenue to cover the losses caused by the pandemic, which is why they increased tobacco tax. Nevertheless, it is for us better than nothing at all to do. In conclusion, the COVID-19 pandemic has highlighted the need for strong tobacco control policies, especially in countries like Indonesia, where tobacco use remains high. The pandemic has also exposed how the tobacco industry can take advantage of the crisis to advance its own interests, including through CSR washing and lobbying for tax breaks. However, the government should have a commitment to avoid conflict of interest that can affect the policies set by the government towards the tobacco industry. Moreover, CSOs in Indonesia have been working hard to raise awareness about the dangers of smoking during the pandemic and push for stronger tobacco control measures. The government has also taken steps in the direction, including increasing tobacco excise tax. Moving forward, it is essential that all stakeholders work together to ensure that tobacco control policies are strengthened and enforced to protect public health, especially during times of crisis like the COVID pandemic. That's for me. Thank you for listening, and I hope this has been informative for you. Thank you.
Thank you so much, Tina, for sharing that experience from Indonesia. Our next speaker for the day is Sam Halavi. Sam serves as the co-director of the Center for Transformational Health Law at the O'Neill Institute and is a professor at the Georgetown University School of Health. He's also the Senior Associate Vice President for Health Policy and Ethics at Colorado State University. Professor Halabi advises or has advised the COVAX facility, the World Bank, the WHO, the National Foundation Centers for Disease Control and Prevention, the Global Virome Project, among others, national international organization. Over to Sam for speaking about redefining alcohol and tobacco regulation in a post-COVID-19 era.
Thank you, Kashish, and I'll keep my remarks brief just because I want to leave appropriate time for answering questions, some of which have started to queue up. First, and really speaking across the comments made by my co-panelists, it's important to understand that alcohol and tobacco measures are pandemic preparedness measures. There's already been an effort in terms of revision of current international health agreements in the development of the new pandemic treaty to essentially treat sort of technology transfer, the development of vaccine manufacturing capacity as the primary foci of those efforts. And while that's important, it's also important that alcohol and tobacco are factors for at least two reasons. First, on a direct and primary level, they facilitate transmission, especially commercial establishments that offer alcohol for consumption. Second, tobacco consumption and alcohol consumption are correlative of more severe outcomes from COVID-19 and are very likely to be so for future respiratory pathogens with pandemic potential. Second, there needs to be the equivalent of Article 5.2, the Framework Convention on Tobacco Control, which declares that there's a fundamental and irreconcilable conflict of interest between the interests of the industries that promote and sell alcohol and tobacco and public health objectives, including pandemic preparedness objectives. And finally, one of the cross-cutting themes across all speakers has been the importance of taxation measures for both alcohol and tobacco. Alcohol and tobacco tax increases have been declared a best buy or a win-win, and that's especially true in pandemic circumstances where governments who see their revenues fall as a result of declining economic activity can use alcohol and tobacco taxes as a way to supplement revenue and to invest in cash transfer schemes or other support mechanisms like addiction support. Overall, I would say that there was a general tendency across both regions for the same analysis of alcohol and tobacco measures to be rolled back as though they were the same kinds of measures like school closures. And I would suggest in the future, a kind of one-way ratchet approach needs to be applied to alcohol and tobacco measures. That is, as soon as they are enhanced or increased, the default should be that they are not rolled back because they play such an important role in pandemic preparedness and in public health outcomes. So thank you so much, and I look forward to the Q&A.
Thanks, Sam, for those brief remarks. So moving forward to the Q&As session, we have three really interesting questions. One, the question is by Rituparna. She says that, given that home delivery of alcohol and tobacco products has escalated during the pandemic, as noted by Rudiger, and that social media platforms are increasingly allowing transactions on their sites, how far can such platforms be held accountable despite them claiming immunity from a prosecution on grounds of being intermediaries? That's a very interesting question. Who would like to respond to that? Yes, Sapura.
Okay, I can give it only a try and just say that, to be honest, this has posed a particular problem. And I think this is globally the case, that social media and online stores and platforms are globally difficult to regulate and very difficult to manage. And I think it's something that a lot of governments are still thinking about, at least in South Africa. When it comes to alcohol and tobacco, the primary focus is around how do we stop marketing on these platforms? But I think particularly with COVID and the increase in home deliveries, there is a need to begin to think about how do existing sales regulations and existing licensing arrangements apply when you don't have someone who's sort of the seller is not the person who's delivering the item. So who's liable when somebody forgets to check an ID, for example? These are all very big questions. I won't say that South Africa has an answer, and to be honest, I'm not sure I have one either.
Just to add to her, basically, it's like advertisements, like online, and then sales. Both these, they are cross-border issues, and many of them, not kind of addressed by completely by the national laws as well as WHO-FCTC insofar as tobacco control is concerned. So now, with the quantum of sales which happened online during the pandemic, then we need to see and we need to look at within the existing laws and provisions what is possible, and if we need further strengthening of the laws, amendment of the laws, or the new laws and regulations. So I think that is one of the lessons. Thank you.
Thanks, Jagdish and Sapura. That was really helpful. The next question we have is from Juan. It says that, could you elaborate on the role of civil society in supporting restrictive policy measures, and what conditions should be put in place to ensure a proactive role in future pandemic events?
Maybe I'll try to share in Indonesia condition. Okay. Well, citizens in Indonesia play a very active role in overseeing the control of tobacco consumption, considering its impact on exacerbating COVID-19 patients. But unfortunately, our government is more concerned with the infrastructure and the equipment in handling COVID-19. So, well, in Indonesia, CSO already tried to try the best for the handling the COVID-19 with government, but enrolled to the tobacco control, but the government not really concerned about it.
Thanks, Nina. Rudiger.
Yeah, thank you very much. I think that's a hugely important question. With regard to civil society organizations, they are so important to, number one, spotting what's happening in countries, as you were just saying, Nina. If the civil society organizations actually can spot what's happening in countries, for instance, on the issue of digital sales, on selling to minors, and so on and so forth. So then I think number one, government can be made aware. If it's not by themselves, international organizations can help to then also put some pressure on on governments and regulatory authorities to see what is happening at the moment and how they can actually enforce regulations on that. And thirdly, I think we have now established a forum of civil society organizations at WHO to discuss with us, what are each of our roles and how can we best serve the purpose? Because there's a lot of things that international bodies cannot do that's international or national civil society organizations can very well do. So I think we need to better understand what each other's roles and responsibilities are, and then actually create those often quoted synergies through that. Just as I have the floor, just let me also say that we are also doing some work now on digital marketing and what is happening on health law with this. So what are the regulatory mechanisms put in place by member states to regulate digital marketing of various products and services, and also then see how country experiences evolve with better regulation of that digital marketing in their own jurisdiction. So I think that's also something we want to add value as WHO to the broader debate. Thank you.
Thank you so much, Rudiger. And that sounds really interesting on digital marketing. I think we all look forward to reading that report from your team. Jagdish.
Basically, the civil society is the whistleblower, and they are the watchdogs at the ground level, at the grassroots level, and they are the first ones to note and report. So their role is very critical, and they are our partners. Most countries in the national tobacco control programs, we have a very defined role of civil society organizations, and in fact, they are doing very well. It's a very good collaboration, and you just can't, I think, do tobacco control without them, because if they don't report the violations, if they don't report during the normal times also, and it becomes very critical, more critical during the pandemic and such emergency situations. So I think they have a very important role to play. Thank you.
Great. Thank you, Jagdish. Anyone else has any other comments in this question before we move on to the next? Yes, Safura.
I just wanted to add something from South Africa's experience, which is we had the South African Alcohol Policy Alliance that was very active on this issue. But what we found time and time again is that when it came to the policymaking process, they were not invited to the table. They were often closed door meetings between industry and the government, where industry was able to put out sort of their concerns around economic harms, etc., and basically advocate for the ban to be reduced. But there wasn't the same opportunity for civil society. Obviously, they made their best efforts, but I think that's very important to recognize that they're not just on the ground, they need to be given a seat at the table. And then I think they also play a critical role in litigation. Industry is not afraid to use industry associations and other fora to litigate their interests. I think similarly, civil society should be active, not just in initiating cases, but acting as amicus curiae or friends of the court in these critical pieces of legislation. Those are really opportunities where nobody needs to invite you to the table. You can invite yourself.
Thanks, Safura, for sharing those thoughts. We have one more question from the audience. It's a question based on data. So Tony asks if in England, the highest percentage rise in numbers drinking at probable dependent levels was observed in the 55 to 64 age group during lockdown. Given the possible rise in home drinking during the COVID-19 pandemic and the rise in alcohol-related harm in the older baby boomer populations, is there similar data available at a global level? Anyone has any insights or any reflections on this question?
Yes, of course, we do have data at the global level on global alcohol consumption. Indeed, different population age groups have different consumption behaviors, and we do see indeed a reduction of alcohol consumption in younger age groups, where the age group that I'm representing are having the highest levels of alcohol consumption, especially in men. However, if I'm looking, as it is World Women's Day today, we're also seeing with concern that alcohol consumption patterns equalize. That means, especially in my age group, also women tend to now drink more, and that being culturally accepted, especially in the European region, as the question came from Europe. And that's of course of concern. So there's a cultural acceptance of alcohol, a quite high level of alcohol consumptions in Europe, and that's something we together jointly need to address, because that's not healthy at all.
Super. Thank you so much, Rudika. I have one last question, I think. As you all know, there's a pandemic treaty being deliberated at the WHO, and we have the Framework Convention on Tobacco Control, International Treaty, Article 19 WHO Constitution Treaty on Tobacco. What are your comments on a treaty on alcohol control, and will such a treaty be helpful in reaching the alcohol reduction targets? Anyone would like to take up this question?
Kashish, you may, of course, think that, of course, I have a view, because indeed, as you rightly introduced, the role I have, we are having the tobacco control work, as well as the alcohol control work in the department I'm leading. Of course, as we see, there's the Framework Convention on Tobacco Control that is, of course, a legally binding mechanism. And in WHO, and that's why you're mentioning the treaty, we do at the moment currently only have two legally binding conventions or treaties. It's the International Health Regulations 2005, and it is the Framework Convention on Tobacco Control. Of course, if you look then at the overall success of tobacco control overall, while we're still the David against Goliath game here, as the tobacco industry is criminal in what they're doing, and is actually trying everything to now reach to our children very young in with their what they call novel products, e-cigarettes and vaping. So the tactics of the tobacco industry, of course, are criminal. And they try to undermine all the governance, the regulations and all that. And we actually have a hard time in meeting up to that fight. With regard to the alcohol industry, as you know, we do still have in WHO dialogues also with the alcohol industry, in looking that they have a sort of, at the moment still, a self-regulatory mechanism to reduce alcohol consumptions overall, and to actually follow an overall agreement how they would act. So what shall I say? I think the results of that dialogue is mixed. I'm honestly thinking we need to shift gear here, because we see oftentimes that the self-regulatory mechanism is not very impactful. So where we see that there's very clear industry tactics as well to get special groups consuming special products, like you have these, as we have Women's Day today, the targeted young women or girls alcohol consumption with alcohol pops and products that are really geared towards the girly, like happy, meet together and enjoy life, whatever products, and that of course is done on purpose to actually get more young girls and young women to actually consume more alcohol. So I would say this is just one example of how the industry is trying to enlarge their scope and their sales, while it would be good to have a real effort to reduce alcohol consumption overall, and especially to minors, which they would on a narrative always support. But in actual fact, the way products are designed now, they are targeted towards very young consumers. So I do have some questions to the alcohol industry, and I could add many more questions I have, where we now need to see, is it serious, or do we need to shift gears here? So the answer is, let us see and observe very carefully.
Thank you, Rudiger. Jagdish, you had your hands up. Do you have any comments?
I think Rudiger captured all the points. He comprehensively responded to the question, and basically just a line. There have been, some calls and some discussions on having a treaty for alcohol, also a global treaty like we have FCTC. And some people say, because because it's legally binding, then governments are committed. But because how this treaty came into force, I mean, that was a long drawn process, and demand came from the member states, and how we went ahead. So that depends, how if the governments want, because if there is appetite, and how to move forward. And then there's a lot of industry interference Rudiger spoke about. So that needs to be seen, because I mean, that's quite a tricky one. Thank you.
Thank you so much, Jagdish. Unfortunately, we don't have more time for questions from the audience, but Hannah, I'll definitely get back to you on email. At this stage, on behalf of the O'Neill Institute, I'd like to thank our speakers for taking out the time to be here today for this insightful discussion, which I'm sure is just the beginning of redefining alcohol and tobacco control regulation in the post-COVID-19 era. I would also like to thank our colleagues from WHO, especially Juan Taylor from the Alcohol-Less Unit for his endless support. These two policy briefs would not have happened without the support of our expert in-country contributors from across countries. And there's a long list of contributors here in both the Southeast Asian region and the Africa region, including ministry officials and CSOs who have helped us and extended their support in different stages of the project. We are grateful for their contribution. Finally, but definitely not the least, I'd like to thank our comms team at O'Neill, Cynthia and Bethany, for all their hard work over the past few years. Thank you to our global audience for tuning in to this virtual event. We look forward to engaging with you in the future. The Center for Transformational Health Law is hosting another important event on Friday, March 10th, where along with the Global Health Security Agenda, we will explore the role of legal mapping as a tool for legal preparedness. You can find registration details for this event on our website. We hope to see you there. Thanks again. Goodbye until next time.